Governor, I received a comprehensive and pretty impassioned email last night from a board member from the Rumford Little League. He also coaches AAU baseball. And they have come up with the screening protocols, release waivers, health monitoring and reporting. They got charts and diagrams that, quite frankly, no offense, look better than some of the ones going up here at these briefings. So they're locked in, and they're looking at other states, they're looking at Massachusetts. And so I know what you said a couple of weeks ago, that it didn't really look too optimistic for this summer. They want to know, has the data and what you're looking at changed? Because they talk about not only the physical, but the mental and emotional, all those things we've talked about this spring with the kids being out of school. They're looking to salvage something for their kids this summer. Yeah. So has your thinking changed on that?
Yes, so I think, as I said yesterday, tomorrow I'm going to talk about youth sports for the summer. The CDC put out guidance a week ago, and we want to enable youth sports. The CDC says not really to allow the competitive sports, like one team versus another team. So that may be difficult, but tomorrow I'm going to go through all the details, but I will say today I'm enabling camps and sports camps, and we are going to enable youth sports with new rules.
Who have you spoken with specifically? I know you have all these focus groups and experts in whatever, Dr. Scott's in a lot of this. Have you talked to people like this, people, AAU people, and to come up with maybe a compromise to how to do that? Who specifically is sitting in on those meetings?
So Janet Coit is running that, and I'll have to have her tell you exactly who she talks to, but she's exactly talking to people who do Little League. You're talking about Little League specifically?
Little League, organized sports.
Yeah.
Soccer,
Yep. It's exactly who we're talking to. By the way, that's exactly what we're doing. So let me be clear. I want to enable youth sports. There will be youth sports this summer in Rhode Island. And we're talking to people who coach Little League groups, coaches at high schools, That's exactly who we are talking to, because what we're asking them is, what do you think you really can do? It's very similar to the gyms. Like, we could say this is what you should do, and if they say to us that is not feasible, but we can get the same result with a different way, then we want to do that.
If you haven't spoken with the Rumford Little League, you should take a look at their, but I'll pass it along. You should take a look at this. It's pretty comprehensive.
I will. I've been to their opening day a few times. They have an amazing parade and such. They're
probably like to have another one this year.
They're very well organized, but I will take that and we will call them.
Governor, the House Republicans today called for the House Oversight Committee to convene to specifically look at your administration's handling of the situation in nursing homes, claiming these daily press conferences aren't really giving enough of a look into nursing homes. What's your response?
If they want to do a hearing, obviously that's their call. We have done everything we know how to do with respect to nursing homes, and I have tried to be as transparent as possible. And by the way, we're way ahead of many other states, if not most other states. I mean, just compare the experience of our veterans home compared to Massachusetts. We've offered testing to every resident and every worker in every nursing home, and we're committed to retesting all workers every 7 to 10 days. We've had the National Guard go in to help nursing homes with infection control. We were very early in shutting down visiting hours and visitation. We have our support teams that are going in and helping nursing homes with whatever they need. We came out early with wage subsidies or wage bonuses in order to help the lowest wage people. We've been constantly supplying PPE. So, look, the reality is it's really hard. Working in nursing homes is hard. Look in every state. It is where we are struggling the most. Us too. So I'm not saying, if anyone has a specific idea, if that committee wanted to be a productive partner in saving lives, then give us some concrete ideas, because we are wide open to that. Second guessing what we've done, I'm not sure how that's very helpful at the moment. The other thing you have to remember is, if you look at Rhode Island's mortalities per capita, we're doing better than our neighbors. So the fact that our mortalities in nursing homes, are high, says as much about the fact that we've kept overall mortalities low, the fact that they've been primarily concentrated in nursing homes is a very sad reality, and one that we're trying to get better at every day.
If I could just follow up with Dr. Alexander Scott, could you just tell us how many of the newly reported fatalities were in nursing homes? And also, has the now next round of testing all nursing home staff been completed? I think that was supposed to start a couple weeks ago.
So 16 of the 21 fatalities, sadly announced today, were associated with long-term care facilities. We are coming towards the end of the second round, and we'll be able to provide further updates in terms of how that goes. And the governor really, explained it effectively, what the challenge has been. We've talked about the leadership and the commitment of people in nursing homes, being the second family for the residents in the nursing homes, knowing how challenging it is without having visitors who were there, and just remaining committed. We can and will continue to put all of our energies into providing the resources that are needed across the board with nursing homes.
Governor, if kind of zooming out on Brian's question, another point, I was over at the press conference with the House Republicans. They're arguing that, and I haven't looked, but they say there's a precedent going back to 1932 that they don't have to depend on Speaker Mattiello to reconvene an active House, that if they have enough members of House oversight that agree to step forward, they could meet outdoors in a park or on Zoom, whatever it may be. What's your response to that, just in general, on members of the House coming back to session, even if Speaker Mattiello says, you know what, we're not ready to come back to session?
That's their call, so I let the legislature run their business. I don't actually know the legislative rule to which you reference. That could be true, so I'll let them figure it out. I will say this. Certainly, for the legislature to come back into session crowded into the State House would be a disaster and unsafe. And I actually appreciate the support from the Speaker and Senate President throughout this entire time. They've been nothing but supportive. So I am not getting in the middle of legislative squabbles, but from my perspective, they've been supportive, and I respect the fact that they want to follow the rules. And bringing their members back into, and the staffs, before you know it, it's hundreds of people squished into the State House. That, I know, is a very bad idea.
That's one thing that Minority Leader Filippi actually referenced, was that basically addressing the public, don't allow the call for social distancing to disrupt a reconvention of House oversight or the body at large, that there are ways to do it electronically, remotely, or in the convention center, whatever it is. Your response to that as well?
They're going to have to figure it out. Follow the rules, though. The rules apply to everybody, so follow the rules.
Governor, are you speaking to restaurant and bar owners who are not represented by the Rhode Island Hospitality Association?
Yes, restaurant
owners who don't jive with all their policies,
Absolutely.
like opposing minimum wage?
Yeah, I think yes, the short answer is yes. We found that these town halls are a very effective way, like on the, when we did town halls with barbers and salons, we had thousands of comments and people get involved. The one that we did with restaurants, same thing. So yes, we're trying to touch as many as we can. Recognizing, let me be very clear, no one's going to be happy with these rules. I get that. I hate having to make them. And they're not meant to be permanent. It's about a month. So are we talking to thousands of the big and the little and everyone in between? Yes. Do I expect to have consensus? Probably not. It's just the nature of it.
When the government sets the floor for the standards for reopening, and let's say some restaurants don't feel that it's safe to reopen yet, doesn't that put them at a disadvantage competitively? It's because they're not able to, maybe not able to for several reasons, to reopen? Well,
let me say this. I have to make policy for the state. And we are at a point now where we have very high unemployment. We're in an unsustainable place economically, and the public health advice is that it's safe to reopen restaurants. So if you don't feel that you, given your circumstances, can reopen safely, then I respect that. But I feel, for the state, it is safe, and I think it's time. I think it's time. I feel the same way about churches. You know, I had a call last Friday with a group of faith leaders. They were like 50-50 divided. Many of them said, Gov, no disrespect, but we are not reopening at the 25%. And I said, fine. You know your people, and you have to do what you think is right. But I think it's safe.
And just one more thing about rental assistance. Is that coming tomorrow?
Yes, I promise.
Scott. Back to nursing homes really quickly.
Sorry.
I'm sorry. Are there specific preparations underway for a possible second wave at nursing homes specifically?
Well, we are trying to avoid that. Let me say this. I don't necessarily agree with those who say there will be a second wave. Now, there may be, and we have to be ready. But on a call yesterday with the White House and Dr. Fauci said there may not be a second wave if you do everything right. If you have adequate testing so you can pinpoint outbreaks before they get out of control. If you have adequate contact tracing so you can, keep a lid on outbreaks before they get out of control, et cetera, et cetera. In nursing homes, they have to continue, as they're doing, to up their game around infection control. So, yes, we are planning, and we will be ready. We'll be more ready because we've been living with this for 10 weeks. But I don't think it's inevitable. I mean, it's exactly why we're retesting every 7 to 10 days. If you retest every 7 to 10 days, the hope is that you can spot a problem early before it mushrooms.
And I guess this week for the governor and Dr. Scott. So would you say that Dr. Fauci is still a primary source for information? You just mentioned what he said about, he doesn't believe in the second wave. This is sort of a pattern here that's going with him flip-flopping on issues. A couple weeks ago, he was saying that there could be a second wave, and he was warning about what could happen with that. He also talked about masks and downplaying the virus in January a little bit. So do you think there needs to be more of a secondary voice instead of everybody relying on Dr. Fauci's opinion?
We definitely don't rely just on him. I mean, we rely heavily on our own staff. We talk to folks at Johns Hopkins. We talk to the folks at Brown. We do talk to Fauci. We talk to Deborah Birx. We talk to the people who run the FDA and the CDC. I talk to other governors constantly. Nicole is constantly in touch with her colleagues, other directors of health around the country. I mean, look, the reality is there is no playbook. There is no playbook. And every day we learn something more. And I'm not at all surprised that somebody would say something now and say something different later, because we've never gone through this before. So what I'm trying to do is just read and study and listen and to as many smart, educated people as we can, and then, make a decision. If you want.
Yes, and our additional experts that we're absolutely relying on are the infectious disease docs that we are talking to on a regular basis with our critical care providers, and all of the national experts that the governor shared. We've said from the beginning that this disease, the pandemic, is evolving, and we are living that. And so our key is to make sure, as the governor mentioned, that we stay up on it and then relay it to you all in a clear, timely, and understandable way.
And knowing what you know now about, the virus and, knowing about the infection rate and how to contain it, would you re-omit patients back into nursing homes if there was a second wave? Would you feel comfortable doing that, or do you feel like you have different tactics to use so you don't have to do that?
Re-omit?
If patients were to go back to track COVID, would you use nursing homes again in the future if there was a second wave?
We would definitely continue the approach of limiting visitation and making sure one of our core public health response components has been what we are calling cohorting, keeping patients who are COVID positive or exposed to it together and keeping patients who are not together as well. Also limiting admissions to a nursing home and focusing on going to a place where there are other patients that have COVID. That's the approach that we know is effective and would want to continue going forward. Is that addressing the question you were asking?
Governor, could you touch on funeral homes?
Jordan and then John.
Oh, okay.
Governor, just to clarify, you said that the guidelines for fitness centers are being modified based on what you're hearing through
They
the
already are. I think they should, if you go on reopeningri.com, they should be up.
Okay, and
I'm sorry.
yeah, I'm looking at it now. I just didn't know if there was something in particular that had been changed since this morning.
Yeah. You want to answer it? That would be a good test to see if it's been updated.
We appreciated the feedback from owners of gyms and fitness centers about how to best achieve the physical distancing component that we know is critical. One of the approaches was to offer a person per square foot number and approach that allowed businesses to be able to apply it in a way that works well. And we got the feedback that it is more challenging to use that as opposed to keeping the particular number that aligns with the social gathering number of phase 2 and maintaining the minimum 6 feet social distancing while wearing a mask, environmentally cleaning, and doing all of the steps that need to be done. So we've been able to update it to really focus on that piece and less so require the square footage.
What about those distances that the businesses that would prefer the square foot distances, because let's say, you know, it's a class environment that they have the square footage to accommodate more than 15 people?
That's something that we would want to continue to encourage in having the 6 feet of distance in place. And the groups of 15 is really to be able to, one, maintain that distance, but then two, help us in terms of exposure and doing any evaluation to ensure that it's not, significantly more than the number that we need to understand who someone was exposed to and how to contact them. So during this next phase, the step is to take it in that stepwise pattern. For the subsequent phase, we will look to expand further.
Governor, could you touch?
That was sort of the whole point, which is we have a goal, which is to keep everybody far enough apart, and particularly if you're exercising 14 feet. If it's easier for you to do that by spacing out the 150 square feet, that's one way to enable that. We heard from smaller owners, they said, well, we have ways that we can guarantee the social distancing and mask wearing, but you put us out of business if you required 150 square feet. So we said, fine. So, but if you're bigger and you want to do that, that's fine. We're trying to be flexible.
Could you touch on funeral homes as far as funerals, wakes? How does that start to change in phase 2 or into phase 3?
Yeah, no, exactly. I was thinking phase 3, phase 2. So churches and synagogues, all places of worship, starting this weekend, can be at 25% capacity. And so if you want to have your funeral in a place of worship, then you have to follow that rule. Thereafter, for wakes and indoor events, that's still the 15-person limit in phase 2. For phase 3, we're going to be upping that, and we haven't yet figured out how high we're going to go.
So funerals and wakes, they stay at the 15 limit. The new limit, which would be 15.
Yeah, in the funeral home, but at the church or the synagogue, 25%.
And Governor, could you just touch on Judge Flanders seems to be intimating about a potential lawsuit about religious rights taken away. Any response to that?
I don't agree. We have not prevented worship at any time during the crisis. We have limited it to the number of people in a place congregating. we allowed worship at all times. We encouraged creativity, like drive-through kind of ceremonies. And again, this weekend, there'll be many places of worship that will have a more traditional celebration. So as with all things, did we have to, because of the public health emergency, change the rules? Yeah, absolutely. But we felt it was necessary. And at no time did we discourage people from, praying or expressing their religious freedom.
Governor, the American Civil Liberties Union, about a half hour before we began today, filed a lawsuit against the Department of Labor. And what they seem to be asking for, essentially, in the suit, and I read it very, very quickly, so I apologize, but they're saying that because of the investigation of potential fraud, a number of people just were shut off on their benefits without any kind of notice or opportunity to respond, and they're asking for the state not to do that and be ordered by the federal court not to do that. And it seems to me that that's a very odd kind of thing that has to reach the level of a federal lawsuit, and the state logically could agree amicably to try to notify people if their benefits have to be terminated and give them an opportunity to be heard.
Yeah. So, like you, I was told about that as I walked up here, so I haven't read the papers and I'm not familiar with it in detail. Here's what I will say, because they have filed suit. There's a national problem now. Many states, including Rhode Island, have been the victim of fraud, some identity type of fraud. And that is under investigation, and I would refer any questions for that investigation to the Colonel of the State Police or the Attorney General. As part of that, we have had to freeze the payment for some Rhode Islanders because that was the appropriate way in order to protect people in light of the fact that we've been the victim of a cyber fraud. So we have been striking that balance between making sure everybody who's owed, who's got a legitimate claim, gets their money as quickly as possible, and also we're protecting everybody from a fraudulent attack. We have been notifying folks, in most instances by phone. I believe the ACLU is requiring or requesting that we do that by letter. It's a lawsuit, and that's all I have to say about it. The Attorney General will defend us. What I can tell you is it has been a top priority of mine to get money into the hands of people who are unemployed quickly. We were the first state to stand up the PUA and start getting that money out the door. We worked very quickly with Amazon Web Services to leverage new technology to start pushing money out quickly. And the last thing I want to do is anything that slows down getting money into the pockets of deserving Rhode Islanders. Having said that, there's fraud happening, and we also have to protect ourselves.
Well, the gist of the ACLU lawsuit, from what I did read of it, is that when people had their benefits turned off, they had no way to get in touch with DLT, and other than just sit on the phone for hours unsuccessfully.
So I'm not going to litigate the lawsuit here. If you have other questions about the lawsuit, you can call DLT, you can call the Attorney General. If you want to know about the investigation, you can call the State Police.
Last two questions. Kim and Brian.
I
just wanted to ask about the antibody tests. The CDC says they might be inaccurate and that governments who are using them shouldn't be making policy decisions based off the results. So I'm just wondering, again, how do you assure Rhode Islanders that the results that I believe you're going to be announcing later this week are accurate, and what will we be using that data for?
It's a great question because it allows us to reiterate the message that we have been sharing about the antibody test. It is still too early to really use that in the normal, everyday setting. We very much appreciate the tremendous work done by the Rhode Island COVID Testing and Validation Task Force that the governor activated. I have regular conversations and did most recently with Dr. Caliendo and Dr. Curtis, who has been leading that group. And they are encouraged by what information we are getting about the test, but stand very strong and clear in saying it is not yet enough for us to say that this should be used in the everyday scenario. So our approach since the beginning with the antibody test has been for us to learn more about the test. What can we understand? How can we use it in the future to inform the work that we're doing? But we've known since the beginning that it is not a test that should be used by itself in letting an individual know specifically about their immunity, and it's why, particularly with this study, we're doing the PCR test and the serology test at the same time.
Will you be conducting more of these randomized antibody tests? I think they were sort of put on hold, correct?
We will be. We will be. The focus had been to redevelop the next plan and cycle that out. We want to continue to balance it with the PCR. We are developing a partnership with the Centers for Disease Control and Prevention to allow us to really learn more together. The national level, everyone is trying to understand what we can from this test, and we want to continue to make it clear to the individuals in Rhode Island that it should not be used alone to interpret their results from a COVID-19 standpoint, but to thank them because it is extremely helpful for us as a state and then also as a nation to gain the information that teaches us more about the test and how it may be considered in the future.
Last question.
Governor, I just wanted to clarify on the gym reopening. Does this include like kids dance and gymnastics and martial arts studios, or would that fall into to youth sports? Like if they can follow these rules, can those kind of activities?
Yes. Hockey rinks, any kind of fitness, exercise-related places.